Good morning, Illini. Welcome back to Healthy Illini Podcast. I'm your host, Matt Schrock, and we're glad you're here with us as we continue on in this semester. If you're a first-time listener, welcome. We're glad you're here. Check out our archive. We have a number of episodes on a lot of health and wellness topics. And if you've been with us since the beginning, we really appreciate you. It's been a journey, and we're looking forward to continuing that journey. Today is another, it's kind of a twofold episode in that it's a continuation of a series we've been doing on careers in healthcare and talking about different roles and different aspects, but we're also introducing a new aspect to McKinley. So not only are we talking about the career role here, but we're also this is the coming out party for one of our new employees and new positions here at McKinley. So I'm looking forward to having this conversation. I'm joined today by Alex Burris. She is the medical care manager here at McKinley Health Center. Got her bachelor's of social work here from UIUC back in 2016 and joined us back in the fall, but wanted to give her a chance to get her feet wet a little bit before we asked her on the program. But Alex, thanks for being here.
Thanks for having me.
So we do pride ourselves on giving high quality care here at McKinley, and part of that involves continually looking for ways that we can serve students, that we can give, we can meet them where they are, that we can provide resources that they need, and we're constantly looking to expand. We've expanded some other areas in the building just in the last 6 months, and so that's been very exciting. But one of the areas that we've expanded into is adding a care manager to our staff, and we really wanted to have this conversation not only to highlight that we do have a care manager, but also if I go to somebody and I say, hey, we just added a physician, people have a basic idea what that means. Yeah. Hey, we added a nurse, that basic idea what that means. Hey, we added a care manager. What? You pause because people don't really know what that means in a context. It's an unfamiliar term for a lot of our listeners. So let's just start right there. What is care management in general, and what does your role mean?
So a care manager, or you may have heard it called a case manager, we are in lots of locations. So medical places, mental health facilities. I've heard of even veterinarians having a case manager. Essentially, our job is to help connect you with the solution to your problem. So a lot of times that's resources in the community you may not know about, food resources. I connect a lot of students with therapists in the community when they want long-term therapy, other financial stuff, but really any resource in the community that you don't know how to get yourself, a care manager can help you find. And problem solving, talking through what's going on to help you make your own solution for your problem.
And that's important just in general. I know that I'm a parent of a special needs child, and we have had various case managers, helpers through the school, through healthcare systems, and it's hugely helpful because, I've obviously grown up going to the doctors and things like that, but this was a whole new area. Yeah. This was a whole new aspect for us, and so that was a huge thing for us. And but oftentimes people think of that kind of care as, special needs or special cases or whatever that may be, but it's not. It's just general care too. Mm-hmm. And so that's one of the reasons that this is so important now for us here, because we talk a lot about McKinley and just campus healthcare being a teaching, guiding time for students who are taking ownership of their own healthcare. And so a lot of times when you step into that, you have no idea what you're doing. Yeah. And so why is it so important? Or let me rephrase that. What are the advantages of a student coming to you and just in general trying to, and the role that you provide for them in navigating healthcare?
Right. So exactly what you were saying. A lot of our students, this is the first time that they have had to take care of their own health without the help of their parent or guardian or an adult. And that can be really intimidating and scary. It was for me when I was in college, because you don't know where to start. So a lot of times, what I do and what Kaylee, she's our other care manager, we meet with students who maybe this is their first big medical thing, and we help them understand maybe what the physician has said, or we guide them through, the process of whatever their next step is. So for a lot of them, that might be a referral to another provider like Carl or Christy, which can also be scary because it's off campus and you don't know anything about that. And another advantage is that I have lived here in Champaign-Urbana for many years, so I know what the resources are. And for a lot of our students, they moved here for college, so they don't know, where to find food or where to find other resources in the community. So the real advantage is just having someone in your corner who knows how to help you figure out what your next steps are for any problem.
Yeah, because you mentioned it and you hit right on it that it's not a one-dimensional assistance in what you do, because there may be somebody who comes in who understands the healthcare, but there's some terms being thrown around. They're like, I don't know what this means. Or they're familiar with the way their home healthcare runs as far as like referrals or where things are located, but now they're in a new setting. And we all know that, one hospital does it this way, another hospital does it that way, another doctor's office does it this way. And so it could be just terms and understanding. It could just be, I just need directions.
Yes. Or help following through sometimes. Sometimes we get busy with school and we forget that we were supposed to call.
Well, and students have so much on their plate.
Absolutely.
And so just having that little extra assistance.
Someone else paying attention to the fact that you have to do something is helpful sometimes.
And someone who can cut through the confusion.
Absolutely.
And make some clarity there. Because sometimes the answer is very simple. But when you don't know, you're trying to figure it out. It looks like a huge, mess.
Yeah. And I think people, of all ages, but people get scared when they hear any kind of health situation, and that makes it harder to, know where to look if you're already kind of amped up. So having someone who knows where to look for the resources you need when you're in that, that situation that's a little scary for you is very helpful.
I think of it kind of, and this is just me, I think of it kind of like when I get my taxes done. I know people who do their own taxes, and awesome, great for them. Yeah. I am not that person. It makes me nervous. I don't want to mess something up, that kind of thing. So having that person that I know that we go to and say, hey, can you help us navigate this just a little bit? And she does. She lines it all out for us, and we're great. And that's kind of it's just getting that little extra peace of mind.
Yeah, that's a great analogy for it. Actually, I'm going to start using that.
You're welcome.
Thank you.
The check will be in the mail for that consultation. But okay, so somebody's listening and they're like, okay, this sounds cool. I would like to, have some help in this, or I have some more questions in this, or whatever. How do they connect with you? What's the, because again, medical facility,
right.
Is there a referral process? Do they have to make an appointment? Do they walk in? What is the process for meeting with you here if you're a student at University of Illinois?
Yeah, it is super easy for the student. You basically just tell your doctor, whatever provider you're seeing, your PCP, psychiatrist, in women's health, whoever you're seeing, you tell them that you want a referral to a care manager, and you tell them why. Doesn't have to be a big, long explanation, just like, I need help finding food. They will fill out a little pink slip called a referral slip, and they will send you with it to the front desk, and the front desk will help you schedule an appointment with me.
How long are appointments with you in general?
It depends on what we're doing. Typically, the first one will be like 45 minutes, but they range anywhere from like 15 minutes to an hour, just depending how much we're working on that particular day. So I would budget about 45 minutes for your first one, and then if we have follow-up appointments, I'll tell you if it's going to be longer than probably 15 to 30.
So as someone's listening and they're wanting to meet with you, again, we talked about how they connect with you. Are there is it important to do it at the start of your healthcare journey? Is it important after you've established with your PCP a little bit? Is there any kind of, or is it just kind of however you feel, timing wise?
I would say however you feel. Anytime you feel like you need a little extra help, you can ask your PCP or any provider to refer to me, and it's really just dependent on what you feel you need help with.
Going back to this new position here, you have a background in social work.
Yes.
So for somebody who's coming in, can you explain how that gives you an advantage in assisting students? That it's a slightly different perspective,
right.
Going in. How does that help you in connecting with the students and bring them to that assistance and help them guide them where they're going?
Mm-hmm. Many case managers or care managers have a background in social work, because social work teaches you how to find resources and how to support people through kind of nebulous problems. So in that way, it helps me connect with students because I have that educational background, and I also have a professional background in, I actually worked in mental health case management for several years. So I am very familiar with and comfortable with your emotions, and I think that can be scary for, students to bring that to a new person. Don't be afraid if you're nervous, or if you're scared or having an emotional situation. I can help you with that, through that too.
And we've talked about in a lot of other aspects on this program, if you've listened to other episodes, that, we're part of a very, very talented, very capable, very intelligent campus, and that cuts both ways in that we have brilliant students, but nobody wants to look like they don't know what they're doing, right. And they don't want to look like they don't understand something. Mm-hmm. So it can be hard to reach out and hard to ask. Yeah. But that's kind of the role you're here for. Mm-hmm. And you also have the secondary, for this particular position, the secondary advantage that you were a UIUC student. Yeah. So you understand campus. Mm-hmm. You know where things are. You kind of know how things work and that sort of thing. Mm-hmm. So there's just a lot of advantages there for students who want to take advantage of what you offer. Yeah. So before we close, this is kind of going back to our series on healthcare careers. We talked about the position, we talked about what you do and that sort of thing. Mm-hmm. But with that series, one thing I wanted to do is try and give opportunity for our staff to share a little about who they are outside of the job. Mm-hmm. Because we're all guilty of it. I've talked about it before. I go to my local post office and I know the person behind the desk. I've known them for a long time. Now, I'm fortunate in a small town. I know them outside of that. But like here in town in Champaign-Urbana, I go to a store and I see the same cashier often. And in my mind, that's kind of where they live. They're the cashier who stays there. They don't ever leave. They're always there when I need to come in. But that's not true. They have a whole life outside of that store. Yeah. And here at McKinley, we have lives outside of this job. Mm-hmm. And so I want to give an opportunity to kind of share a little about who you are. Mm-hmm. So, Alex, what are some things like hobbies, anything you want to share about who you are outside of the walls of McKinley and your life outside of care manager?
I'm a big crafter. I like to make things. I particularly like to refinish furniture. I don't think any of my furniture is new in my entire house. I secondhand buy it and then I refinish it. And I just recently bought a house, so my house is kind of my hobby right now, fixing it up. I have a cat named Olive. She's 5.5, and I've had her about 1.5 years, and she's a snuggler, so we hang out and watch movies together a lot. And then my other big hobby is I play Dungeons and Dragons.
Hey, all right. Love it.
Every other Monday. So actually, we're recording on a Monday, and tonight is my D&D night.
Very nice. Yeah. And D&D with the onset of Dimension 20 and Critical Role and the way you can do online games and stuff has just exploded in a lot of ways. So that's really cool. Okay, so I'm going to nerd out for a second. If you're not listening and you're not, this is not you, I apologize. But all right, what system are you running and what's your class and race?
Okay, so bear with me because this is my first party, and I'm not the DM. Okay. I actually got into it because my friends play D&D, and I was just like, it's an easy way to hang out with my friends regularly. So I'm not new anymore because it's been like a year, but the system is 5e, I believe. Mm-hmm. Yep. Where actually they just made some changes to it. So my DM is working on making some changes to that. And then I am, it's so silly because I picked the things I thought were funniest. So I'm a gnome. Her name's Ursula. She's a gnome and she's a monk.
Nice.
Which is the weirdest combination I could think of.
So for anybody who's listening who's not a D&D player, you're like, this is all for me. Anyone who knows is like, awesome. I know exactly what you're talking about. So no, that's really cool. So that gives again, it gives context to who we are outside of our jobs. And we have students that are so multifaceted in what they do. They're in classroom, outside of classroom, and whether they're working, things like that, their backgrounds, where they come from. And so it's just an opportunity to kind of share a little bit about who we are outside of this and kind of what we do outside of here. But again, if you're listening and you're a student at the University of Illinois, care management is for you. Mm-hmm. There's always something that you can utilize. And again, it's one of the things that we have on this campus. We have so many resources. It's wonderful, but you can kind of get lost in the shuffle sometimes and you forget about things. If you're trying to navigate healthcare and you're a little uncertain, care management is here for you and here to help you. Mm-hmm. So Alex, thank you so much for being on the program today. Thank you for sharing about your role, and we're happy to have you here in McKinley.
Yeah, thanks for having me. I'm happy to be here.